Hello, my name's Adrian Richards and in this video, which is part of our series on body lift surgery, I'm going to be talking a little bit about some of the complications that can arise following this type of procedure. So the first thing is you really need to be in good physical shape prior to a body lift. That means ideally you need to have no significant heart or lung problems, and your body mass index needs to be under 30. Problems you can get problems actually in the operation, which can either be related to heart or lung problems or bleeding. Now these are very rare, if you've got experienced anaesthetists and experienced surgeons. So following the surgery, we're taken back to the ward, and things to watch out for then, things that the nursing staff will look out for, is bleeding essentially in the first 24 hours. So the drainage bottles will remove any sort of small amount of excess blood, but if a blood vessel does open up, you will develop a blood clot internally, and this may need to be removed and the blood vessel sealed. This happens really rarely, probably in my practice of treating just under 1,000 patients per year. I may see one patient with a hematoma per year. So it's very rare, and I don't think it should worry you too much, but it is a reason why you should really be kept in hospital. Infections can occur. I've talked about laminar airflow theatres. I think they're really important at maintaining clear air in the operating theatre, reducing any possible bacteria in the area which can cause infections. So talk to your surgeon about the type of operating theatre they use, and laminar airflow I think is the way to go to reduce infections. Telltale signs for infections, which normally occur about the 5th day following surgery. Because if you do get any bacteria contamination during surgery, it takes about 5 days for those bacteria to grow to a level where they're going to cause a problem of infection. So any temperature, shivering, if you feel a bit shaky, any of those sort of problems, pain in the area, perhaps you may have an infection, you certainly need to get this checked out by your surgeon, and we have a 24-hour helpline. If you are concerned, we will get back to you immediately, because infections are normally very mild. If you can treat them, get on top of them with antibiotics early, normally they don't progress too far. So infection, very rare. Laminar airflow theatres I think should really reduce that risk. Problems you then can get are seromas, which are collections of your body fluid. Your natural body fluids is called serum. So a collection of serum is called a seroma, and that's basically where your body makes fluid which may pool together underneath the skin. We've much reduced the risk of that with the use of drains and actually sewing the skin down internally. You may still get that to a certain extent. Most are very mild and don't need drainage. Some just need to be drained off through the skin by your surgeon in the weeks following surgery, but they're pretty rare in most people's practice, but they can occur. They don't have any long-term implications really, but can be a bit of a nuisance. And the main other issues you can get in the long term are to do with scarring, and it might be worthwhile having a look at our videos on hypertrophic scarring and some of the measures you can take to reduce the risk of scarring and improve your scarring, with the aim to get it to heal in a nice, fine, silvery scar in the months and years following surgery. So our aim with scarring is to conceal it within the type of clothing you wear. So often I'll ask my patients to bring the type of underwear and swimwear they would like to wear, so I can design the scar to lie within the outline of that clothing. And then there's measures we can take to really try and get the scar to heal and mature and disappear as much as possible. If you are considering body lift surgery, please feel free to contact us. We can put you in contact with someone who's had surgery recently if you'd like to hear first-hand experience of what was involved in surgery, their recovery period and their results. If you're wondering whether you'd be suitable for either a tummy tuck, extended tummy tuck, body lift, thigh lift, inner thigh lift, send us your photos and we'll be happy to give you an opinion on this. And we'd love to see you, if you are considering surgery, please feel free to schedule a consultation by ringing us or emailing us, and it will be great to see you for a consultation. So thanks very much for watching the video, which I hope you found useful and informative.